Right, Dipak, hello, nice to meet you.
Hi, nice to meet you too.
First of all, I think we should start with what's your background? I'm a pharmacist, and I'd like to hear what your background is.
Well, I'm a paediatrician. Yeah. I work at Evelina Children's Hospital, which is a specialist children's hospital in central London. I'm Dipak, by the way, Dipak Kanabar. So I'm here at the pharmacy show today because I'm doing a presentation to all those attendees who've turned up today, talking about common winter illnesses that affect children in the United Kingdom.
And how can pharmacy help here?
Well, it's a very good question, because pharmacists can do an awful lot, especially nowadays when you've got overcrowded hospitals, GP practices that turn away patients because they haven't got enough room for slots for visits, etc. So pharmacists may well be the first place that the parent may come to for advice.
Okay, so this very much feeds into the issue of the A&Es being overcrowded and the GP surgeries as well, with worried parents.
Absolutely.
And helping them go and choose the right options to help them and be flexible.
Absolutely. So a lot of parents now will come to a pharmacist hoping that the pharmacist will give them good advice about how to treat their child who's got a feverish illness. And that's what I've been talking about this morning. Children get a lot of feverish illnesses, particularly in the winter months, things such as the common cold, things such as influenza, some weird and wonderful things like slapchick disease, and we all dread the norovirus that spreads like wildfire amongst families in the winter months. So with these common conditions in the winter, pharmacists can offer advice, reassurance, and send these families back to their home environments where they can look after their own child, feeling safe and secure that they're doing the right thing for their children.
So that's a very good thing you've just brought up, because it's something to do with confidence, isn't it? Because sometimes parents think, I'm not quite confident here, I need to see the highest level of professional that I can because I'm really worried and I need to do something quickly. But what you're saying is pharmacists are more than equipped to do that.
Absolutely. As long as pharmacies follow certain guidelines, as long as they practice safely, as long as they know their own limitations and boundaries, they can give an awful lot of good advice to families with feverish children. So, for example, a mother might come along, she's probably armed with some information already because she's talked to a neighbour who's got a child, or she's looked up on Mumsnet or one of these social websites where mums get a lot of information. So they're coming to you really for backup of the information that they already have to be certain that they're doing the right thing. And usually it's things about fever management, hydration, because those are the kind of things that parents worry about. They don't know that their child's got common cold or influenza or norovirus or whatever. They just know that they've got a very sick child at home who isn't doing the things that they normally do at home, and they're coming to you with some pre-armed knowledge, sometimes naively as well, and they're hoping and expecting that a pharmacist who's qualified is going to give them good safety advice.
And pharmacies, and pharmacists are more than equipped. They cover all of that sort of thing in the undergraduate teaching. They learn how to prescribe over the counter,
yes,
in amongst other things. So they also, as you say, really importantly, need to know where their boundaries are about actually what are risky symptoms and when to refer. And I think that's where the health system needs to get confidence that pharmacists can do this and know what to do.
Absolutely. And remember that once a parent has got that advice and they feel reassured, they can come back to the pharmacist on another occasion knowing that that's a safe place to come for good advice. And really, if as I said before, the pharmacist is equipped with some knowledge, and today's pharmacy show I talked about influenza and the common cold and how it can present. And I also mentioned a very important thing this morning, which was that although people regard fever as something that's very dangerous, in fact, a lot of studies are now showing that fever is not a bad thing, because the underlying thing about fever is that it's fighting the infection. We've developed an immune system that creates a fever, and the reason why that's evolved is because it's fighting the underlying infection. What the feverish illness and that virus does, it then makes the child feel uncomfortable. So it's the uncomfortable feeling that the child has, the temperature that they have, the fact that they're not eating or drinking or they're not as active as normal. That's the thing that you want to just overcome in the first 48 hours. And the pharmacist can give that advice very quickly, make a quick assessment of the child in the pharmacy, and then give some very simple, reassuring advice about temperature control, how certain agents such as ibuprofen and paracetamol can be used, how it's important to maintain hydration, and work within safe limits to give that family real good reassurance and advice so that they can go walk out the door, go back home, and follow through with everything that's been given.
So what you're saying is it's worth that real investment in time with the first time that patient comes through the door to make sure that you get the repeat person coming in again and again so that they're trained that actually this is the right place to come.
Absolutely. Familiarity, seeing the same senior person in the pharmacist, if you can achieve that, giving good advice the first time that worked, making sure that the pharmacist is acting in a professional way, they've talked through the various options, makes families feel totally trustworthy of their local pharmacy practice. And I think that's what we should be now moving towards, particularly in this environment where getting good health care is really important for the United Kingdom, but also making sure that the resources that we have that keep our wonderful NHS working are used in a way that utilises all the facilities within that health service, and pharmacists play a key role in that.
So it's understanding that pharmacy is part of the NHS.
Absolutely.
And we need to use the whole system. We keep hearing that pharmacies are underused.
Yes.
And what are the top 3 things that you would say you'd like to see pharmacists doing in the future?
Okay, so I'd love to see pharmacies coming to shows like this where they can come and learn some of the things that we're talking about today. I'd love pharmacists to make sure that they're up to date with information and knowledge, so talk to representatives from companies that come and sell their wares, which sometimes seems like a selling tactic, but in fact there might be some information, particularly some of the companies I've worked with recently, who are very keen on education. So work with some of those companies, and then finally making sure that they give that very confident, reassuring advice to families that's been well researched and well thought through. And those are the 3 things I think that pharmacists can achieve over a very short period of time.
Okay, well, thank you, Dipak. So you've heard it here. The 3 things that you should be doing. Pharmacists should be coming to shows like this. You should be keeping up to date, and you should be speaking to everybody out there to find out all of that knowledge that is already out there and embedding it in your practice. So thank you.
Thank you very much. Bye-bye.
I'm Terry Maguire and I'm a community pharmacist and I work in Belfast. I have 2 pharmacies there. I also have an interest in public health and I'm Honorary Senior Lecturer at the Queen's University of Belfast, where I speak to the students on public health, particularly obesity, smoking cessation, those sorts of things, and trying to get innovations in pharmacy practice that will bring these new services into practice. And I've been working on those for quite a number of years.
Okay, so I first met you a long time ago when we were doing some conferences, weren't we, together about thinking about what pharmacists can do. And really, we're starting getting there, aren't we? We're delivering some of those services we've been talking about for a while. But what are the services that you would like to see embedded in community pharmacy?
The motivational interviewing is a generic skill, and it's my feeling that if you look across public health and you look at social inequalities in health, what you're seeing is that there's about 4 or 5 behaviours that actually result in a significant burden on the health service. Respiratory disease caused by smoking, diabetes caused by lack of exercise and overweight, and finally blood pressure and stress. So the idea is, could you actually motivate the pharmacy network to be much more active in supporting people to bring around change? And motivational interview seems to be the solution to that.
So that's motivational interviewing for the actual pharmacies to get them on board, but also I'm wondering, and from an insight, is whether we actually need to be using it in our practice to help motivate patients and get them on board to do the right thing.
Oh no, that's what I'm saying.
Okay,
it's really using the professional contact,
right.
And in the context of professional contact, not ignoring a public health message.
Yeah.
For example, when you're dealing with someone who has a sore ankle or a sore knee or whatever else, and you come down to discuss the fact that, say, an anti-inflammatory may be appropriate or some other analgesic, that's fine. But then you have to take the wider context. The wider context may be the person's very, very obese and it's the weight on the joints of the problem. Or the person, in actual fact, may have some other issue. So it's what can you do for that individual in addition to supplying them some... and that is motivation interviewing, which is about a discussion process which actually asks open-ended questions, and pharmacists don't like open-ended questions because it takes up far too much time. And it's making sure that people identify what they want. So in other words, what's the advantages to you of change? What's the disadvantages to you of change? But doing this subtly in the context of professional contact. So it could be dispensing a medicine, it could be advising on a cough mixture, or it could be a health campaign the pharmacy is running. So that, to me, is really where we need to get to in terms of public health, in addition to the other stuff we do. I mean, the medicines are going to be vitally important. And even compliance in medicines itself is something you can use that technique in.
I couldn't agree more, and I certainly have been advocating that myself for a number of years. So it's looking at even things like the behavioural insights team.
They use motivation interviewing and they use the nudge theory.
Exactly.
But if you actually look at it in detail, we're not trying to turn pharmacists into specialist psychologists. You're just simply trying to get a proactive engagement in a way that will support motivation to change, and more importantly, giving people the ability to change. Because motivation is one thing, doing something about a problem is another, and that's where the services come in. So if you have a robust service, evidence-based service, then that will bring about the change. And obesity is a very good example of that. Obesity is a very, very difficult problem. But the person needs the motivation to want to change in the first place, but then they need to know how they can bring that change around.
Absolutely.
And that's quite a challenge.
Yeah, so we need to get to know our patients a bit better to be able to achieve that, don't we? It's like you need to have your goal, because if you don't have a goal, you're not going to get anywhere.
If you don't know where you're going, how do you know when you've arrived?
Exactly. So, yeah, I couldn't agree more, and I think we need to be thinking about how we can spread that through pharmacy more, because, as you say, it applies to every service within pharmacy, from actually dispensing your medicines through to all these additional services that we should be doing.
Where it must come into is the issue of contractual obligation. So I think the services that we're actually commissioned, or that are commissioned, whether they be commissioned locally or nationally, they need to reflect this. So unless they're built into the service level agreement or the service specification, then it becomes more difficult, because one pharmacist in one area will be doing it one way and another pharmacist in another area will do it another way. Whereas we're looking for is, basically to take this generic skill and to apply it across. For example, we have a contract on obesity, we have a contract on smoking cessation, we have a contract on sexual health. And the sexual health contract allows us to provide emergency mode of contraception to a certain age group. But in addition to that, we then actually look at safe sex, and we look at STDs, and we look at contraception. So we're really we're breaching our contract if we don't do that.
But it makes sense to all be aligned. It's silly just looking at one specific item, isn't it? Because you need to look at the whole.
Yeah.
So if you would say, what are the 3 wishes for pharmacy for the future for you?
The pharmacists become the primary access point for public health advice. And I think the network is robust enough, it's wide enough, and we are in areas of social deprivation. Really, public health is about bringing the worst off in society up to the same quality of health and longevity as the people at the top of society. And it's that social inequality in health, really, which is what the health service is focused on. And I really do believe pharmacy has the ability to deliver that within a range of contracted services. And it's not very complex if you consider the fact that you've only got 4 or 5 key things that drive social inequalities. That you can, which are the behaviours which you can modify. You won't solve problems like security or education or jobs. They're important, but they're not something pharmacy has to get involved in. So look at what we can make a change in, and I think we really can make a big change in those areas.